Good morning from Madurai. In today's Vizhiparivu, we're going to see one topic, whether it's a good idea to gift a set of flowers to a patient who's recovering from corona. So this takes us to the topic of black fungus infection or mucormycosis. What are these fungi? The mushroom you see is a fungus. The mold you see is a fungus. The yeast you use for baking is a fungus. And look at this mango. The center black thing is a fungus. Sometimes a spoiled bread, when you open, you see black threads. That is a fungus. And fungus is also found in cow dung. The cow dung is used for sprinkling water in front of the house. It's also used as cakes, as a fuel for burning. So all these places, the presence of fungus is ubiquitous. It is found everywhere, but it does not always cause disease. So when your defenses are down, say you're a corona patient on steroids, or you are on any other drug that is going to reduce your immunity, you're going to be a candidate. So when does this happen? So you're a patient with corona, you have diabetes, at the same time your defenses are too much that the doctors believe that your defense mechanism has to be blunted. That is where you use steroids. And the steroid is a double-edged weapon. So on the one side it helps you, on the other side it can kill you. So this is how the steroids are used. So when a black fungus or mucormycosis happens, what are the areas affected? First, it can affect your nose, eyes and brain. It can affect your lung. It can affect your skin. So this is how the body is affected. And what are the signs and symptoms? There can be redness of face. There can be redness of eyes. The eyes can start popping out and the brain starts malfunctioning. All these things you see. So what is the treatment option? The only treatment option is an expensive drug which is very, very expensive. You have to use it for 2 to 3 months. And the other is radical surgery, like removing the eye or removing the jaw. So the best thing is not to get the infection. So one of the things not to get the infection is that, the steroid should be used with caution and your diabetes should be in control, and you have to cooperate with the doctor so that your diabetes is under control and you don't get exposed to these kind of molds. The next thing is keep your intensive care settings clean so that these fungi doesn't colonize your equipment. So in our series, we have seen a number of patients. We have not seen one case of black fungus infection, though I hear about them in Madurai, and many of them they present to eye hospitals these days. So the threat is real, but we don't see many. So end of the day, the question is whether it's a very good idea to present a set of bouquet or your flowers to the patient. I'd say definitely, preferably you avoid, because there is a small danger of giving the black fungus to the patient. So the idea of my video is that, we talk science in my videos. So if I tell you, take a glass of hot water, put 3 cubes of ice and have it. It's good for you. You may do it, but it's not scientific. It's not true. But if you add a bit of ethanol and you enjoy it, you're a realist, and it's fine with me. I have no problem. So follow me in Captain Dr. Dodd video series. We'll talk science and we'll interact. Thank you very much. Have a wonderful day. Stay safe.